most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, Brad, we're going to talk about the best sleeping position for back pain, neck pain, and sciatica. These are tips from physical therapists. That's what we are. And by the way, if you stumbled upon our channel, welcome. And if you are new to our channel, please take a second to subscribe to us because we provide videos on stay healthy, fit, pain-free, and we upload every day. Also, you're going to want to join us on our social media channels because we are always giving something away, Brad,
You
right?
better believe it, Bob.
So especially go to bobandbrad.com, go to giveaway section, or go to Facebook. It's always pinned at the top of the page. We are this week giving away the Dozeology Weighted Blanket. This thing weighs 15 pounds, but it's great for anxiety.
Sure.
And really calms you down. So nothing else, you can't get out of bed because it weighs you down, right? So you sleep longer.
Yeah, get the freebie to sleep
That's
in.
right. Well, we're actually going to bring Liz in here in just a minute. Just wait a minute.
What about me?
Yeah, you're going to kick. No, well, you can
I'm
stay
out.
too. You can stay too because we don't have to do any camera angles here.
Okay.
So when we're trying to establish the best sleeping posture, Brad,
Sure.
we're looking at two main things. One, we're trying to keep the back in a neutral posture.
Neutral.
Yes, neutral.
You better do a little explaining
Yeah.
there.
Now, if you're standing this way,
This way.
and he's got good posture, he's got a slight curve in here, a slight curve out here, and a slight curve in here. If he's in bad posture, he's kind of rounded out like this. So when he's sleeping, we want to have him in that same position. Slight curve in, slight curve out, slight curve in. So as we're going through the different positions, we'll mention this.
Lots of curves, Bob.
Yep, lots of curves.
Okay.
And the other thing we want to make sure is that joints are not at their end range.
Sure.
So like if your neck is all the way rotated to the right,
Right.
it is at end range. That's not going to be comfortable.
Right.
If your arm is curled up like this all night long,
Right.
it's not going to be comfortable.
If you lay on your stomach and your arms are up above your head and underneath like that, shoulders are going to have problems.
Excellent point, Brad.
Say no more.
Okay, we're going to bring in Liz, our camera woman, for a number of reasons. One, Liz is a lot better looking as a model, but two,
Right.
we want to mention Liz's channel with Alex.
Oh,
This
say
is her
no
husband.
more,
Oh,
Bob.
we got a sign for that too.
I'm glad you mentioned it. I kind of like the colors.
There
Did
we
you-
go.
I think Liz picked those
Gotta
out.
check it out. It's a funny channel. They go on the family product channel, right? So check it out, and we'll have a link down below. So
Well, we didn't mic Liz up, so she's kind of like a mute.
Yeah, that's right. All right, we're going to start off with Liz on your back. So the first thing you can see here, when you're on your back and you're trying to get that spine kind of level out here, you don't want to have two pillows. Or even too thick of a pillow.
Right. It puts that head in that forward flex posture, that neck, and then
Hey,
there's
look at
problems.
that. Does that look comfortable? I would say not.
Now, some people may do this to watch the TV on the wall or to read a book or look at your tablet, cell phone.
And that's highly not acceptable.
Right. It's not,
So really, actually, a thin pillow if you're going to be on your back. And then we're going to go along. We're trying to get that little bit of a curve, especially if you're having back pain in your low back. So in order to establish that, there's a number of things we can do. Boy, I got stuff here, don't I, Brad?
Oh, Bob, you got all kinds of gadgets.
Why don't you sit up just for a second, Liz? You can actually take a rolled sheet.
That's what we have here.
Yeah, and tie it around her.
Here, can you grab that, Liz? There you
Well,
go.
You can go around 10 times on Liz
Yeah,
here.
well, yep. There you go. So that's going to provide that lumbar support where that natural curve is just above the belt line.
Right. Why don't you go ahead and lay back down, Liz? We're going to be a lot up and down here. But so now you can see that curve has been established. So
You can feel that support there, right, Liz? Now, I don't want to wish I can get into this, but I know with the right kind of mattress, that can also do this as well.
that's right. The Sleep Ovation mattress. We're going to
which
give it a mention here. The other thing is there is a sleep roll you can buy from Mackenzie.
Yep.
And this just ties around here. And you're going to see that it actually comes in handy also when you lay on your side.
Right.
But we'll mention that. Right. Oh, you can leave that on right now.
Oftentimes, I'll use these with people with sciatica for sleeping.
Sure.
The sleep roll. But, this is an option. It's not quite as nice as these, but it's much cheaper.
Okay.
And it's right there.
Liz, we're going to have you lay back down again. Up and down, up and down. All right. The next thing is, right now the hips are kind of extended, aren't they? They're at end range.
Well, that's pushing it, Bob.
It is, but to be honest with a lot of people, especially if they have tight hip
Yep.
flexors, the tight hip flexors are going to attach to the pelvis,
Sure.
and they're going to pull your back like this.
Exactly. So we get that anterior
Tilt.
pelvic tilt. Puts
Right.
a little stress on things.
Right, it's not comfortable. So I think you'll find most people will
Right.
find that they are more comfortable with a couple pillows underneath the legs. So yes, you're going to have to invest in pillows, but it's a good investment, especially if you're having back pain. I think a lot of people find this to be a very comfortable position with back pain.
Are you comfortable?
There you go.
You want to fall asleep, Liz? Yes.
All right. A different device for if you want to purchase something, and we are big fans of this. Brad, you're especially a big fan of this.
Yeah. I use these probably 90% of my back patients while they're getting a cold pack on their back in the clinic. I keep one next to my bed though when I need it.
Yeah, this is the pillow wedge. Is that right? Yeah, that's what it's called. No, leg wedge.
Leg wedge.
Yes. And they're not they're like $25 or something like that.
Right. You get them online, ship them right to
I
your
know
house.
some people would ask how high they are.
Yes.
I don't think that really matters to some.
Well, I think it's 8 inches. I should have my measuring stick here for that, but
my hand is 8 inches long. Look at that.
There you
it's
go.
8 inches.
This is this right here angle is a key thing with this that separates it from the pillows.
Sure, it does. This for some reason this feels really good to get constant contact all the way along the leg.
Do you agree, Liz?
Yeah.
Well, what else is she going to say?
I know she can go like this. She can go that. So,
well, of course.
All right, so that covers on the side. You know, one thing, Brad. Do we want to mention? There's that other wedge.
Oh, the wedge.
You'd have to find it, right?
Well, it's right on the other side.
Okay,
of
I'll
our
do the
curve.
side one.
Yeah.
And you can go look for that.
Yeah.
So now
I'll be right
we're going to
back.
have Liz lay on her side. She's going to roll towards me. This immediately shows you why this works out well for this on the sideline. Because normally as she lays on her side, the back is going to sag down a little bit. And this actually helps maintain that curve now even when she's on her side. So it serves a dual purpose basically. Now, when she's on her side, this is a case where you may actually want to have 2 pillows or double up your pillow.
Sure.
Because this is a wider gap here. You got
to make up for that shoulder.
And we don't want you this way. We don't want you this way. We want you right in the middle. You actually don't look too bad right there, Liz, with that. So I would probably not make any change to that
And
right now.
we don't want to mess up her hairdo because I really like it today.
All right. Today, you mean you didn't like it the other days?
Well, this is
Oh,
different.
Liz,
Don't put
Liz.
me in a position like that. I've been
Okay.
married.
The other thing is if you don't have a pillow between the leg, what happens is that you're actually putting a little twist on the back.
Sure.
The
Yep,
pelvis is coming
pulsing.
over.
Especially if this knee goes forward like
Right.
that, then we get a little rotation.
So it's good to actually put a pillow between the legs. And what are you laughing at?
More pillows.
Yeah, that's right. It's really not that many, though.
No, but it's true. It makes
if
a big difference.
If you get by with 3. So this is a very comfortable position. You may want to go this way so that it gets between the ankles, too. So
Well, she doesn't sleep. You sleep with your shoes on?
no, she
good.
says no. Okay. One other thing I was going to mention for the neck, Brad,
Okay.
and I haven't used this too much, but I've used it a couple of times.
Mhm.
You can actually take a pillowcase and you fold it in half lengthwise.
Yep.
And you fold it again lengthwise.
You could use a towel if you wanted.
And you could use a towel, but this actually works pretty well. And you go around like this and you pin it,
Mhm.
and it just gives you a little support. It prevents you from doing this
Right.
and and this. So it kind of keeps you in line.
Sure.
So you can do that, and you can have it on laying on your back
Yep.
or laying on your side.
And, that's one of those things. If someone has a neck problem, we'll do that. It's kind of like it reminds you.
Like a collar. It's like a
Right,
neck collar.
yeah.
It's more of a reminder because it's a very soft collar.
Right.
So
Keep so you get your pillow in the right position, etc.
where we're in this position, Brad, before we get to right back to that, I'm going to
Yes.
show one other sciatica position that works out really
oh,
well.
Oh yes.
So let's say Liz is having sciatica pain down the leg, this left leg. What you want to do is lay on the side so that the painful leg is up.
Okay.
So this is the painful leg. And what we're going to do is actually you take just one pillow and put it under the ankle. And generally, a lot of times what it takes is 2 pillows.
Okay.
But you take 2 pillows, you give it a try like this, and it just, by angling the legs this way, you're opening the back a little bit. And I've seen quite often, you've seen this too, haven't you, Brad?
Yep.
Where it actually takes away the pain and they're able to sleep.
Right. And you'll know it. You just try it, and if it works, it's going to work. Right now, it's say, oh, that feels better. Then you use it. If it doesn't make it feel better, don't.
Right. So we're going to swing back to going and having her on her back. But
Yes.
before we do that, I'm going to mention one last thing. What about on the stomach?
Oh, yeah.
Basically, we're telling you to avoid that as
Right.
much as possible. Your neck is rotated one way or the other. I don't mind if you're there for a short period of time, but I would try not to sleep all night like that. Your back is extended, and there's compression on your chest and the organs, and so
We there's always comments, people that habitually sleep on their stomach, and I guess they've adapted to it. They're healthy and viable enough to
I
do
see
that.
a lot of people that get headaches on a continuous basis because they sleep on their back, but that's just my observation. Okay, Liz, we're gonna have you go back on your back, and then we're gonna take the
wedge,
wedge,
not the leg wedge, just the wedge.
It's just called the wedge.
Yep.
So
I believe it. I sleeping wedge or.
So what's nice about this, I'm gonna have you come up a little bit further, Liz. So yeah, there we go. See, now she's in pretty decent position here.
Sure.
So if she was gonna read a book or watch TV, it's just a lot more acceptable to me.
And also, if some people have a breathing problem or they need to be elevated for their lungs, this is a nice option.
One final thing, we'll mention the contour pillow here, Brad.
Yeah, because, a lot of people ask, is this a viable option? Is it going to be helpful?
It is, but I'm telling you, it's really hard to find one that fits you just right. You may have to order a few before you.
Right, your daughter had done that.
My daughter ordered one. It didn't work. The second one she loved. Mm-hmm. So, it really did the job. So, it's a tough call for me because unless you're going into a store or something, it's
where you can try it. But they're typically memory foam. They have this, so it does support the neck, and it's the design. Oh, I'm talking. Yeah. The design is really quite nice.
Speaking of which, Brad, we only have about 20 seconds left, so Brad and I can fix just about anything
except for
a broken heart.
Right? Maybe Liz can help.
Yeah, there we go.
We never did ask a woman on this yet.
That's right. We've broken some women's hearts. Thanks a lot.